Hello, everybody. Good afternoon. I'm going to say good morning. Good afternoon, Dr. Barry, your favorite board-certified internist, founder here at drpiersblog.com, author, speaker, soon-to-be podcaster, bringing you another edition of the Lunch and Learn. I want to give a shout-out to all of our replay viewers. Who are going to be watching this later on today. Your likes, comments, shares, much appreciated here. And I want to apologize, last week was pretty busy. We didn't actually get a chance to even touch on Tuesday or Thursday, but I did want to continue this topic that we kind of addressed a little bit as far as, being you guys' family counselor, right? Hey, Dr. Shanika, how you doing? It's definitely something that I get a lot in my office. It's of course, I'm a physician, I'm obviously trained to do a lot of the counseling that I do. But it's definitely something that hey Amanda, hey, thank you. It's definitely something that I'm seeing quite often, unfortunately, in my practice, where a lot of my patients have, become the de facto family counselor, the de facto burden wearer of their family. And it's causing a lot of undue stress, pain, and discomfort that they're just not ready for. And I definitely wanted to kind of, put that out there and kind of, see what everyone's thoughts are as far as, the subject was concerned. Because, again, I think I see probably once or twice a week patients in my practice who are dealing with a lot of undue stress. And when I tease down, what the stress is caused, a lot of it has nothing to do with them, right? A lot of that has to do with, let's say they're, the matriarch of the family. They're dealing with stress from the kids, they're dealing with stress from the husband, they're dealing with stress from work, and everything else that's kind of getting placed on them because they've been seen as the rock of the family, which is definitely a term I am not fond of. Reason being is that a lot of times, we do a lot of things to the rock, but we do nothing to, take from the rock. Like, we put a lot of burden, a lot of stress, a lot of animosity on the rock. We just wake up, we dump all our problems on the rock, and then we leave, right? We never ask the rock how the rock is doing. And that happens over and over and over again. And I definitely want to kind of put it out there so that my patients can, first of all, tell patients to stop, right? Like, I think that's the first and foremost that has to happen. Now, hey, Genevieve, because unfortunately, people, I don't know if they realize that what they're doing. I don't know if they realize they're doing a bad thing. Because again, a lot of people are always looking for someone to talk to. They're always looking for someone to, to kind of bounce ideas off of. They're always looking for someone, to kind of release some of the burden. But most of the time, they're not very reciprocal with it, right? So again, I've been out of practice. I've been out of residency for about 3 years, almost 3 years now. But, I went to medical school for 4 years. I did residency for 3 years. So I got about almost like 10 years of, training of, taking on people's burdens, right? Like 10 years of being able to, see a person at their worst and try to, plan and, guide the steps to try to get them to their better. But a lot of y'all, unfortunately, a lot of y'all don't really have that training, right? So a lot of y'all don't have 10 years, 8 years, 4 years. You guys aren't like, classically trained, right, to be able to, one, take on someone's burden and really not affect your day. And unfortunately, you carry that. You carry it to the next day. You carry it to the next day. You carry on to work. You carry on to family. But you never have someone to kind of like outlet, like someone to kind of like blurt it out. And in my practice, sometimes that happens. Sometimes I'm the person that they kind of blurt it out with. And my first question to them always is, well, have you told anyone to, that you probably don't want to deal with any of their problems today? And of course, number one response I get is they don't want to feel less of a friend. They don't want to feel less of a family member. And I immediately say, well, if these people love you, if these people cherish your well-being, they'll be okay with holding on to their burden themselves, right? Because not only do you get undue stress, right? You get anxiety. You get depression. That's going to show up in, medical reasons. Why? So now all of a sudden, because of all this undue stress, because you're taking on the burden of your family, I'm having trouble control your blood pressure. because of the undue, anxiety that you get every time you have to deal with, your children's problems. Now you're having trouble, dealing with your weight. Because all of the stress and angst that you get from your coworkers, because again, they see you as the rock, right? So they see you as a person like, hey, I'm having a problem. Let me go tell, Barry all of my problems, and then so I can feel better about myself, but I'm going to walk away right afterwards, right? Like, I'm not even going to give Barry the chance to dump some of his problems on me, because I'm out of there. Like, I was just there for a one-way street. And I think that's something we have to stop doing now. Because again, it's like, I'm not even figuratively saying it, like, it's literally killing some of y'all, right? It's literally, some of y'all are having trouble, controlling your weight, right? Because you're eating too much, and that's causing stress and pressure and depression and everything else. So you're having trouble controlling the stress. So now your blood pressure is uncontrolled, your diabetes is uncontrolled. So a lot of these medical things start popping up. And it's all from the mental, right? And again, my wife, she's a she's licensed mental health counselor. She's actually working on a PhD right now in marriage and family therapy, and she's big on the mental, right? And so because she's big on the mental, of course, I got to be big on the mental too, right? So she's big on understanding that if your mental isn't where it needs to be, if mentally you aren't ready to prepare yourself from the day in and day out challenges of work, of family, of just personal life, that's going to show up. It might not show up tomorrow, right? It may not show up next week, but imagine as a cumulative effect, right? Imagine, over a week, over a month, over a year's span, right? That you've been sitting there taking everyone's burden. You've been sitting there taking everyone's discomfort, and, you become the sounding board for everyone. But no one's becoming the sounding board for you. That's going to weigh on you. And I have a lot of people I know, especially in this society here, where mental health really isn't something that we like to talk about. And I think a lot of it is because we can't physically touch mental health. We can't physically look at a person and say, do a lab work and say, okay, you're depressed, right? We can't physically do a lab work. I can't do a lab work. I can't do an imaging to say, okay, you have anxiety, you have depression, you have, stress undue for, viruses. We can't physically say that, right? And because we can't physically say that, if you have a broken bone, I can see a broken bone. You have high blood pressure, I can see the numbers that show me that you have high blood pressure. But when we talk about these mental health issues, when we talk about all of the stress and depression, anxiety, and all of these factors here, we kind of brush it off, right? And being in our family, a lot of, especially the African American community, a lot of us are very strongly faith based. And of course, let me give my caveat, so I don't want y'all jump into my DMs or whatever. Don't get mad at me. I have no problem with the faith base, right? But I think the problem with our faith base is that we kind of will neglect, right? We will neglect all of the signs, right? We'll neglect all of the symptoms, and we'll say stuff like pray it off, right? How many of you may have, been going through some things and someone just told you to pray it off? Not to say that pray it off isn't helpful, right? But my always come back, especially when it comes to people who say you don't have this, just go find God. I say, well, God put, mental health counselors, social workers, therapists, doctors, he put them here for a reason too, right? So maybe he's giving you a reason to hey, maybe we should go seek some help too. But, that's something we're not going to go here because I know y'all don't come here for my religious medical versus religious talk. But I do have some, I do feel, of course I'm biased, right? I feel everyone should go to the doctor, right? Because everyone should go to the doctor. You should go to that doctor at least once a year, right? But I also feel if you're having some problems, especially from a mental health aspect, right, you should go see, those experts right there too, right? Again, I got 10 years of, clinical, practice and care. So I tend to do a lot of counseling, right? But, why wouldn't you want to go see the experts, right? Why wouldn't you go see the therapists, the social workers? Why wouldn't you want to go see those people who, that's what they do. They wake up every day and they do that mental health thing, right? Why wouldn't you want to go see those experts when you're looking for help? Hey, Sharon, how you doing? So again, that's my caveat is, exactly. You can't just pray it away, right? The tools are definitely there. But we, especially in our community, tend not to want to use them. because of the stigma kind of associated to it. And let me tell you right now, this is not an African American thing, right? Because our Caucasian community hates using mental health. Hispanic community hates using. This is like everyone for some reason like really hates using the mental health, right? Again. And I know I'm skewed, right? I know because I got a wife who's like right here in my ear, like mental health, right? So she's always like making sure that even if for some crazy reason I forgot one day that mental health was important, she's right there to remind me. So it's definitely not the case here. But I definitely think, it plays a factor in everything, in overall total health, right? From a mental aspect, I think mental health, is just as important as oral health, is just as important as the medical health that I may take care of. And I think that just kind of embodies our total body health. But I think a lot of us are just kind of going through life and we're missing very vital parts, right? We're missing the mental health aspect of it, right? We're not taking care of that, right? So what we're doing, right, we're putting this burden, right, on that family member. And it's usually like one or two family members, right? We're putting the burden on that one family member who we know, oh, I'm going to talk to Aunt so-and-so. I'm going to talk to cousin so-and-so. I'm going to talk to Uncle so-and-so, right? I'm going to tell them all my problems. They always got some good solution for me. And then they just leave. Right, they never give the aunt, the uncle, the cousin any open leeway to try to like, hey, what? Let me dump some of my issues too. We never do that. So I think moving forward, right, this is just more open your eyes. This is very broad, and I'm gonna actually write a blog post tomorrow on a little bit more in depth topic on just being why you guys being the counselor of the family is gonna be killing y'all very very soon, or at least in the long run. We definitely have to really open our eyes, right? So today, right? So, and again, everyone has that person in the family, right? So I want y'all to think about, every time I go to so-so, do I ever ask them how they're doing? Do I ever ask them, what problems, they're going through? Just think about that. Most of you aren't. And it's okay because you don't know no better, but you just watch this video, so now you have no excuse, right? Now hey, I need to see if she has any problems or if he has any problems that they want to get off their chest too. Because the problem is they're not dumping everything on you. They come to us. They coming to the medical doctor, and they're saying, hey doc, something's wrong with me. I'm not sure what's wrong with me. Something's wrong with me. Can you help me? And of course, I'm doing all of these blood works and all this stuff here at the end of the day just to say, I just think everything's up here. And I've counseled, and my patients will tell you, right? I counsel many of my patients to say, hey, you know what? I think you need to really stop telling. I think you need to start telling your family members, don't talk to me, right? I don't want to hear your problems. And it's not being mean, right? You're just trying to protect yourself, because at the end of the day, if the alpha, which is yourself, if you're not taken care of, you can't take care of nobody in the long run. So if you and you have to remember that at the end of the day, right? If you don't take care of yourself, be selfish, right? It's selfish is this word that we don't like to use because there's always negative connotations of it. But when it comes to our mental health, I implore you guys to be selfish. Be selfish. Understand that you have some problems that you need to get off your chest. Find that person. Find those professional people, if whatnot. And again, going back to the church, the church is great, right? There's a lot of counseling that goes on to the church. So we're not telling you to go to church, sit in the back, and then pray. No, we want you to, if I say go to church, I want you to talk to the pastor. I want you to talk to somebody in there to get that off, right? We don't want you to just pray it off, right? We just want you to make sure whatever's on your heart, whatever's sitting, whatever that stress, whatever that, the pain, discomfort, that's eating you alive, we want you to get it out there. We want you to just, because sometimes you don't want to, sometimes you're going to people, you don't even want to, really get an answer. You just want to talk to them just to get it off your chest, just to have it out in the world, because you're going to figure it out. But the problem is you can't even figure it out because you're just keeping it right here. So that's what I want you to do. Do it this week. In fact, do it this week. Do it today. If you're the alpha, if you're the person I'm talking about, the one who everyone dumps their problems on, I want you to start being selfish. I want you to start looking out for yourself. I want you to start saying, hey, you know what? I need to take care of me. And right now, I know you got some problems, but right now I can't deal with those problems right now. And if you're on the other side, if you're the person who's always dumping problems on your family member, I want you to reach out to that family member today and say, hey, you know what? I've been girl, boy, I've been telling you all my problems this past couple weeks, man. What's going on with you? Like, so that's really it. Like, that's, if you don't get nothing from the video today, it's that Dr. Barry wants you to be selfish. If you're that family rock, who everyone's dumped their problems on, Dr. Barry wants you to be selfish and start looking out for yourself, because it's killing you. It's causing undue stress. It's causing it's causing a lack of control in things that I usually look for: blood pressure, diabetes, weight. Like, it's causing all of these problems there. And if you're on that reverse, if you're that person who's always dumping on that rock, I want you to like look into yourself and say, hey, I just realized, yeah, I'm that person. Like, I'm the person who's always telling people my problems, but I'm never actually taking their problems. Exactly. You got to have boundaries. I'm always looking and I'm always dumping these problems. Let me reach out to this person who's my rock, who I recognize as my rock, and say, you know what? What's going on with you today? I don't want to talk about me. I got problems. We can talk about those problems later, but I just want to know what's going on with you today. So tomorrow, I'm gonna write a nice little blog post about it, just kind of in written form, and kind of give some numbers on what's happening when it comes to stress and anxiety, and like how does it correlate from a medical aspect as well. I'll give you some information on people you can see, people you can talk to as well, just to kind of get it out there. Again, you can always go to, like, I'm not gonna say you can always go to the doctor, right? Because I know unfortunately all doctors aren't created equal, right? And my patients will tell you, like, my patients could tell me a lot more things than they may be able to tell their other primary care physician, but I tend to like ask those questions because I'm usually looking for it. So if your doctor isn't the type of doctor who likes to talk to you about, just in general, the mental health aspect of it, please look for your local professional in the area. Whether if you're very religious, please go to church. Don't go to church just to pray. Go to church to talk to someone in the church, and because they got counselors at the church. Talk to them to get your feelings out. If you're in the community, find your social worker, find your therapist, find someone, right? Find someone who is professionally trained to kind of do these things, because that's really how we move forward and everything else, right? Because again, I know I don't get nowhere, right, if your mental is not right. Like, there's no point for me. I can give you pills all day, pills for anxiety, pills for depression, pills that help you go to sleep, pills that help you lose weight, right? But if your mental isn't there, it doesn't matter. Those pills not going to work. So I'm going to see you guys later today again. Apologize for last week. We're going to get right back on our regularly scheduled program. We're seeing you guys on Thursday. If you haven't had a chance, go ahead and check out the blog, drpierresblog.com. We will have... actually, I think I have a free audio course on there now. So if you go, the second you go to the website, you'll see the link for the free audio course, 5 survival tips, just so you guys can be much more proficient when you come to see me in the doctor's office. So go ahead, download that today, and I will see you guys tomorrow on the blog, and then I will see you on Thursday for another lunch or learn. You guys have a great, blessed day. Bye.